All right, so welcome everyone. For those of you who do not know me, and this is your first POLIS seminar series, my name is Christian. I work at POLIS, the Centre for Social Research and Policy at the Australian National University. We host these seminars on a fortnightly basis in semester. As a centre that's based on social policy research, we're really sort of focused on pursuing and highlighting research that has significant social policy impact, and none more so than the topic that we're discussing today in NDIS reform. Before we get started, as is protocol, I'd like to acknowledge that we are meeting on the lands of the Ngunnawal and Ngambri peoples. I'd like to acknowledge their elders past and present. And I'd also like to extend that acknowledgement and respect to those of you joining us from lands across Australia. I know this session has significant interest amongst a lot of people across the country, so welcome everyone. Just a little bit of housekeeping before we get started. So the session is set up as a webinar, so on screen you should be able to see our various presenters, who I'll introduce in a moment. You're able to ask questions either through the webinar chat or the Q&A throughout the session. You can put those in the chat. Otherwise, at the end of the session, there will be a Q&A, at which point, if you would like to ask the question directly to our presenters, if you can just pop your hand up in the Zoom, then I can unmute you and call on you to ask a question. For those of you who want to use closed captions, if you go to the bottom of the Zoom screen, you might be able to, down the bottom there, toggle on show or hide captions. You can also show a live transcript if you choose that option as well on the right-hand side of the screen. So in today's audience, we've got a number of different people from different backgrounds. So largely, we've got a lot of attendees from POLIS, the Centre for Social Research and Policy. Given the focus of the seminar, we also have a lot of external attendees. So the way that the session has been designed is to make sure that we're straddling those dual audiences. So I mentioned, I'll just give a brief overview of the seminar today before I hand over to our presenters. So the seminar today, entitled After a Decade of Reform, Where Next for the National Disability Insurance Scheme, ostensibly focused about the NDIS, launched over a decade ago and was heralded as the most significant social policy reform since Medicare. Now, many of you in attendance will be already well aware of some or all of our presenters. Today, we've got Professor Helen Dickinson, who is Professor of Public Service Research in the Public Service Research Group at the School of Business at the University of New South Wales. We have Alana Starr from the Disability Advocacy Network Australia, who's a project coordinator and a proud disabled person with experience in the disability sector across systemic advocacy, project management, facilitation, and policy writing. We have Dr. Sophie Yates, who is a research fellow at the Crawford School of Public Policy at the ANU, previously a research fellow at the Public Service Research Group, School of Business, UNSW, and the Australia and New Zealand School of Government. And finally, Associate Professor Sue Olney, who is the UOM BSL Principal Research Fellow in the School of Social and Political Sciences at the University of Melbourne, an Honorary Associate Professor in the Crawford School of Public Policy at the ANU, and a Visiting Fellow in the Public Service Research Group at UNSW as well. So with that, I'd like to pass over to our presenters and pass over to Helen to take us away with the seminar.
Thanks very much, Christian, for organising this session and for that great introduction as well. So good afternoon, everybody. Thanks for coming along to this seminar on the National Disability Insurance Scheme. We're going to explore scheme reform in terms of what's happened over the last 11 years or so, and what looks set to come in the near future. So as you've heard, my name's Helen, based at UNSW in Canberra. And I'm to chair the session today. So much of my research is around disability policy and disability programs with a particular interest in the NDIS. I join you today from the unceded sovereign lands of the Wurundjeri people of the Kulin Nation, and want to pay my respects to elders past and present. So in terms of today's seminar, we've got a really great lineup with some fantastic speakers who are at the cutting edge of NDIS research and practice. In a second, I'm going to do a bit of a quick overview of the story of the NDIS so far, and then our panel are going to speak to us about where we think we might be going next. So briefly, after me, we've got Alana, who joins us from Dana, and she's going to speak about research that she's led around priorities for disability reform. Susan is going to then talk to us about foundational supports, and we'll finish up with Crawford's own Sophie, who's going to take us through the new support lists and what's in and out for NDIS funding. So I said I'm going to take you on a whistle-stop tour of the NDIS so far, 4 slides, and bear in mind this is a topic I could probably talk to for about 3 months, so I'm going to be quick and I'll miss some detail, but if you've got questions we can kind of pick those up as we go along. So the idea for a national disability insurance scheme, it's not a new one. It wasn't one that kind of appeared at the end of 2010 and beyond. It's kind of been around since the 1970s as an idea that we need to have some sort of no-fault funding scheme for people with disability. So if you remember, but prior to the establishment of the NDIS, we had this kind of quite odd situation where if somebody had been in a kind of road traffic accident or something like that and acquired a disability, or had acquired a disability at work, they often got access to such an insurance scheme through kind of WorkSafe or the TAC or something like that. But people who were born with disabilities didn't get access to the same sorts of supports. And there was a huge amount of grassroots effort from the disability community to get the scheme realised. So massive amount of campaigning happened in order to kind of provide people with disability with the sorts of supports and services that they need. And the NDIS is actually one of the main ways that Australia discharges its obligations under the Convention of the Rights of Persons with Disabilities. Australia was one of the first signatories to that in 2007. So it's kind of framed, or ostensibly the idea around it was framed in a very kind of human rights perspective. And this idea is that we provide people with disability supports and funding, and we do this in a kind of strategic sort of way that's not based just on kind of crisis welfare funding as we saw with the previous system, and that's a good thing because it's good for the person with disability who's accessing that scheme, but it also saves money in a whole of government kind of way over the long term. So the idea, it's about human rights, it's about better outcomes for people with disability, but it's also about saving money in a kind of cross government way. Now, the initial design for the scheme, and this is changing a little bit as we'll talk about today, was originally designed around 3 schemes. And for those of you around kind of when the NDIS has been talked about as a potential kind of model, there was a lot of a discussion about the fact that, yes, it's a national disability insurance scheme, but it's for everybody because all of us have our lives touched by disability in some way at some point. And that might be either personal, it might be through family or friends, but actually, such a scheme is important for all of us. So the initial idea was it would have these 3 kind of tiers, that you'd have tier 1, which is basically about all of Australia. So it's trying to think through how we change community attitudes around disability and provide kind of safety of mind and security that if should you kind of acquire an impairment or that you would kind of be looked after in some sort of way. Tier 2 essentially targeted all people with disability, and so and still talk about this a bit more, but it's about information, kind of referrals, community engagement, making sure people with disability were getting access to the right sorts of mainstream services. And then tier 3 is the bit that I think we talk about the most when we talk about the NDIS. It gets the largest amount of attention, which is where we give individual funding budgets to people who can then design the sorts of services and supports they want and go and contract for those in the market. The other thing to notice from this is the kind of total around tier three is 410,000. That's how many participants were originally predicted would be in the scheme at the full rollout. We passed that some time ago. Those of you close to the scheme will know there's about just over 650,000 participants on the NDIS today. In theory, it's an uncapped scheme, which is why we've seen some concern as a number of participants have risen. So, of course, the kind of cost of the scheme has risen as well. Even though the NDIS is only kind of 11 years old, there's been quite a lot of kind of reform and policy around it. I mean, so it was great that we kind of got bipartisan support for the legislation to go through in March of 2013. It launched incredibly kind of quickly. So it started to roll out in some trial sites in the July of that year, and then international rollout in 2016. So hugely ambitious, a huge amount of activity to get this in place. And the NDIS has been described as being a plane built during flight. So not everything had kind of been settled before it started to be rolled out. And so some of the issues kind of arose that needed attending to. The NDIS had a number of independent reviews. So we saw the Productivity Commission inquiry into costs in 2017. They had the Tune review into participant experiences in 2019. There was a review of the NDIS Act. At the end of last year, then we saw the NDIS review, which looked at kind of the design of the scheme, kind of participant experience and sustainability. We've got a joint standing committee on the NDIS that kind of regularly reports around this. And then also around the broader kind of disability ecosystem, we've seen a huge amount of activity. So there's the National Disability Strategy that became Australian Disability Strategy once it was refreshed, which was about looking at kind of disability services really broadly. You'll be aware that we had a Royal Commission that reported last year, and we've just seen the NDIS bill that passed a couple of months ago that changes a number of things around how the NDIS will operate. One of the things that bill does is it moves a lot of kind of the detail about how it operates out of the primary legislation into delegated legislation, so into rules. And Sophie will talk about this a bit when she talks about supports. And one of the challenges of that is that the bill is a lot more difficult to change than those rules. And so there's some concern about kind of consistency within there. So I'm not going to talk about this in detail. If you're interested, go and have a look at this paper that Sophie and I wrote earlier this year or last year that's in the Australian Journal of Social Issues. But we talked about in there that there's a number of areas of debate around the NDIS. These are all of them. These are the ones we could fit into that paper. There are many more that we might talk about today. And I raise these because actually these link really nicely to what our panelists are going to speak about today. So one of the things the NDIS should have done is it should have been kind of co-designed. It should have put people with disability right at the centre of the scheme. And there's some criticisms that hasn't happened, and particularly with the debate around the recent bill and the supports, list of supports that Sophie's going to talk about, a feeling that they hadn't always been kind of co-designed. Now, what Lana's going to talk about today is a really good example of doing some co-design with people with disability around kind of priorities. You can't look at a newspaper or watch the news without seeing something about the costs of the NDIS, hugely important kind of backdrop to this conversation. And so too, you can never read anything around the NDIS without coming across a series of different metaphors. So the NDIS is oasis in the desert. It's the only lifeboat in the ocean. And what's being talked about here is that after the NDIS launched, what we saw was states and territories step back a little bit in terms of disability provision. And so that's some of the explanation of why we've got more participants in the scheme than were originally anticipated. So if you're a parent of a child who's got additional learning needs, traditionally you would have gone to the school and you would have negotiated something. Parents are increasingly finding that they're being told, well, if you want to get those supports for your child, you need to get them an NDIS plan. So people are being forced into the scheme because there aren't necessarily those services there in the ecosystem. And this is what Sue's going to talk to us about today. She's going to completely demystify the idea of foundational supports and what they are and what sort of the issues around that are. We know that the NDIS is really complex. It can be difficult to navigate, and participants take on a huge amount of administrative burden around that. Potentially, it's about to get a bit more with some of the changes to supports in terms of what is and isn't funded by the scheme. And Sophie's going to talk to that to finish out the session today. So that's enough from me. I'm going to hand over to Lana now. So Lana works at Disability Advocacy Network Australia. She's going to talk about a project that she's led. It's philanthropically funded, and it explored the potential of disability reform with a focus on foundational supports. It's a great project, and Lana's going to tell us more about that in a second. But the other thing I love about this is it really demonstrates that, and this may be controversial for academics in the room, but the great research doesn't just sit in universities, right? It sits across the whole kind of sphere, and nowhere more importantly than the disability sector, given the kind of experts by experience that we find there. So Lana, welcome.
Thank you so much, Helen, and hi everyone. It's wonderful to be here. As Helen mentioned, I'm Lana Starr. I work for the Disability Advocacy Network Australia, and I led the Priorities project earlier this year. I'm also a person with disability myself. So, as Helen mentioned, I am taking you back a little bit in time to talk about this project, so I just want to be really clear about that before we get in, that we have stepped back in the timeline a little bit. So, between December 2023 and March 2024, we gathered information for the Priorities project, which, as Helen said, was philanthropically funded and with a strong focus on exploring the potential for disability reform led by people with disability, and with a strong focus on foundational supports. So I want to start with the context for this project. This project started the week that the NDIS review final report was released. And the NDIS review and the Disability Royal Commission represent years of storytelling, years of emotional labor, years of lived experience given by people with disability for the potential of reforming disability support for a better future. So the end result of both of those reforms in their final reports resulted in 248 different recommendations and 139 supporting recommendations. That's a lot. So the question then becomes, where do you start with recommendations for reform of that size? So we at Dana decided that we wanted to start by listening. We wanted to start by talking to our community, finding out what was happening right now, what was important, and what real positive changes could be made easily and quickly to improve disability support. So when we started this project, we had a very, very strong focus on listening to the expertise of our community. Because we started this work almost instantly after the NDIS review report dropped, we actually were interpreting and understanding the information in the reform in real time alongside our community. So what we've captured is a real understanding of where things were at that time and how people were interpreting the potential of disability reform, but also a very real and honest look at what the real needs are. So this work was formally launched in June with the Honourable Bill Shorten, MP, Minister for the NDIS. You can see the full final report on the Dana website, which also includes easy read and an executive summary. We spoke to 130 people for this work across 28 engagements and 40 hours of consultation. Yep, you can go to the next slide. So what I want to focus on today is the power of disability-led consultation. So this was work done by our community and for our community. I'm a person with disability myself. My co-facilitator, the wonderful Tori Ha, is also a person with disability. So this was a disability-led piece of work very strongly, which influenced our design, our thinking, and the way that we also connected with our community to talk about the work. So instead of using one formalized process, we used many different ways of gathering data for this work. And this was about responding to the capacity in our sector and also creating spaces where people had the opportunity to think about different key areas and decide what was important. So we spoke to disability representative organizations, the peak bodies for people with disability. We spoke to people with disability themselves. We spoke to independent disability advocates about practical on the ground experience. And we spoke to subject matter experts across many different areas to understand really deep implications of reform. We used a fairly chronological process to do this work. So we began this work before Christmas in 2023 with some informal pre-chats with disability representative organizations to talk systemically about what was being experienced and what felt important from the Disability Royal Commission and NDIS review recommendations. We then had key topic consultations with disability representative organization policy teams on housing, education, safeguarding, and foundational supports. We then moved into a strong foundational supports focus and actually hosted state and territory consultations with independent disability advocates and people with disability on what are the real experiences that are happening right now when it comes to accessing disability support. What are you hearing? What is critical? And what can change? And how is all of that happening in a local way? So what are the key impacts there? So that can be different. We talked a lot about regional and rural experiences, for example, but things are different in different areas and reform needs to work for everyone. So we got a lot of that local expertise. We then moved into what we called Reform, How Do We Get There sessions, which brought together systemic advocates and independent disability advocates to talk about making change. What would change look like if it was done well, and what the real practical needs are that we could ask for. We also spoke about recommendations, and we had the opportunity to field test some of our preliminary ideas on those groups in those sessions, and we got a lot of really brilliant feedback. And so the ideas evolved and grew along the timeline as we heard more and tested and got that really deep expertise. The one thing that I also really wanted to focus on here is that we didn't focus on any particular system. And I know this is somewhat of an NDIS focused conversation. We didn't hold an NDIS consultation for a very deliberate reason, because we were talking about the needs that people with disability have across all areas of life. Many of those areas do intersect with the NDIS, but what was important to us was capturing everything that we needed to hear in order to make a plan for reform. So, all right, let's go next slide. So after speaking to 130 people, we came out with 6 very clear priorities. The priorities were defined by what people talked about the most. So it's a real reflection of where the most critical needs are in our community. Number 1 was access to disability services and supports. This came up across a multitude of conversations in a lot of different ways. But what it comes down to is, can people get the supports they need? Are the supports they need good quality? Do the supports they need exist? What are the barriers? We talked about access to diagnosis, access to adequate documentation to get what you need. There are many different barriers in play right now, and it's a really critical need, and that informs our recommendations. Number 2 was housing. And I want to take a moment here to talk about why housing is different in the disability context, because housing was also having a very strong, broader conversation in the media at the time that we were having these consultations, which was late January, early February 2024. We were speaking quite strongly about the housing crisis in the mainstream media, but the impact of housing is compounded for people with disability. So while housing is still and remains unaffordable and the housing crisis issue is there, people with disability also experience additional factors. So one really good example is that access to disability services and supports and housing are very well linked. So some of the ways this impacts people with disability are, for example, access to service provision. If you live in a rural, regional, or remote area and you don't have reliable housing supply, it can be really difficult to attract general practitioners, allied health specialists, pediatricians, all of whom tend to have a really critical role in, number one, supporting people with disability, but also in providing evidence to do things like access the STEAM. So when you don't have those practitioners available or a reliable relationship in your area, it can be much more difficult to get the support that you need. People with disability can also require housing modifications, of which there are significant barriers in different areas and are currently only funded really by the NDIS. So it's an incredibly critical factor that came up across every single conversation that we had. Safeguarding is and remains a critical priority for people with disability. The body of work from the Disability Royal Commission in particular goes into this in incredible detail, and this was another key factor. If you're interested in reading this, I would really refer you to the Disability Royal Commission's extensive body of work on this particular one. We also spoke a lot about establishing foundational supports. And by that, we mean foundational supports need a strong foundation to be done well. They need to be responsive to the current needs that people with disability are having. They need to understand the differing operating environments in different areas, including regional, rural, and remote, and they need to be available to everyone who needs them. Representation and inclusion. Again, this is very much about making sure that people with disability are in the center of reform. People with disability are the ones having these experiences and have all the expertise and the problem-solving abilities needed to design and create this new system of support. And our last priority was advocacy. So for those of you who may not know a little bit about advocacy, the advocacy ecosystem supports people with disability to realize their rights, speak up against abuse, neglect, and maltreatment, and also has a really critical role in addressing service and support gaps and making sure that people with disability have access to independent support that sits outside of existing service provider type systems. So these are the 6 most important things that we heard from the work, and these are the topics that we based our recommendations from. All right, next slide. All right. In total, we made 10 recommendations across our 6 priorities. In doing this, we had 3 guiding principles. Number 1, recommendations needed to be able to be implemented immediately or very, very quickly. They needed to be able to show measurable and actionable results within 1 to 2 years to support the broader reform rollout, and they needed to be not dependent on any other reforms or processes that were currently in play. So there are many different reforms and changes that happen that impact people with disability. For example, things like the early years strategy, the national autism strategy. Our recommendations sit independently of those. We also had one big focus, which was about not reinventing the wheel. One of the really key changes to the disability landscape over the last 10 or so years because of the NDIS has been that service delivery outside the NDIS has changed significantly as a result. So we've seen quite a strong reduction of services delivered at the local council level, for example, home and community care. And so that means that different services and supports that were traditionally available are no longer traditionally available. However, we asked our community what was important and what had worked for them, and we got recommendations to re-establish previous services and supports. So some recommendations are new, but not all recommendations are new. We also had a really strong focus on solutions that make big changes for the most marginalized people with disability. So this means you can address really fundamental needs in the community quite easily, quite quickly, by looking at what people really need. What do they need in their local area? What needs aren't being met? And this can be, in the context of the foundational support discussion, there's been a lot of focus on, for example, information. But there are other really critical areas like being able to access your community, being able to access healthcare, those kinds of things. So we looked really deeply at what could make real change quickly and have an impact. All right, last slide. So instead of taking you through all of these on a high level, I wanted to talk about the real impact that one of these recommendations can have. We've recommended the establishment of a nationalised home modification scheme to bring some equity into home modification for people with disability. So right now, the only reliable and consistent form of funding for home modifications is the NDIS. About 12% of people with disability are on the NDIS, and many people with disability have support needs that don't necessarily meet the criteria for an NDIS package, but could benefit significantly from lower levels of disability support. So in doing this, we looked backwards for an administration model that we thought could work, and we landed on Job Access, which is the national body for employment support for people with disability. It's a centrally administered scheme. It is nationalised, and it is also centred on the person with disability. The person with disability is the applicant and the one who is communicated with. So this has real potential to make a real change immediately, because right now there is no additional way to meet these needs without people with disability paying significant amounts out of pocket. There are also some really, really critical barriers to home modification, depending on where you live, from a local council level, or if you live in public housing, it can be very, very difficult to get permission for home modifications. So we've also included the capacity to explore and address barriers to home modification that sit outside the financial barrier. This work also fits really strongly into the foundational supports targeted model as something that could be available for people with disability who are not eligible for the NDIS. So in short, the Priorities Project was all about working from the expertise of our community and our expertise as people with disability to talk about where the real foundational deep needs are, and also to talk about the possibilities for solving them and creating a more equitable reform landscape. So thank you so much.
Thanks very much, Lona. That was a great presentation. I know Sophie's put the links to the project into the chat if people want to go and have a look at that in more detail and look at some of the fantastic solutions that Lana and the team came up with there. One of the things Lana talked about quite a bit there was foundational supports, and I know we'd hear more of that from Sue. So a lot of Sue's work focuses on kind of marketisation and its impact around public services. She's done work around employment services and disability services, and brings a kind of a wealth of experience to that. And the research she's going to talk about today is great because she was doing research around foundational, around tier 2 and kind of foundational supports long before that had kind of entered the mainstream lexicon in terms of disability. So over to you. Thanks, Sue.
Thanks very much, Helen, and Lana too. I've just popped a link to that tier 2 research into the chat, which might make more sense as I reach the end of my slides. So I'm assuming that if you're here, you're familiar with the NDIS, but I do want to just set what I'm talking about within the context of our population of people with disability in Australia. So the ABS has finally released some new data from the 2022 census, and we know that there are 5.5 million Australians with disability. And there are 661,267 people who are NDIS participants, which means that they have individual funding through the NDIS. And you'll see from this picture the scale of the number of people with disability in particular age groups against the number of them who have NDIS funding. The other story that's told in this picture is that the prevalence of disability, of course, rises sharply with age. So approximately 2.3 million Australians with disability are aged over 65, and they're supported by our aged care system and not by the NDIS. But there are still 3.2 million Australians with disability aged under 65. And of course, only, as I said, 661,000 receive NDIS funding. So there are 2.5 million people with disability aged under 65 reliant on services and supports outside the NDIS to meet their particular needs. And ABS data shows that that number is growing. So we'll hop on to the next slide, Helen. So having just very swiftly crunched the numbers, I'm going to talk about why support for people with disability outside the NDIS is critical. The first is that we know that including people with disability in the universal life of their community improves outcomes for them and for their families. And importantly, it's their right as equal citizens. But the second part, which is of interest to us today, is that it's a really critical element of the NDIS model, and that is to prevent or delay or reduce the need for them to need individual funding for disability-specific support. And anyone who understands insurance knows how important that is in terms of containing the demand for what's essentially a very expensive way of supporting people. Now, research, endless inquiries, the Disability Royal Commission and the NDIS review in particular have all uncovered very significant issues on both of those fronts, so the economic front and the human rights front. And this is the elephant in the room when it comes to the design and implementation and sustainability of the NDIS. And I'm going to go out on a limb and say to date, it's been all talk and no action. And I want to talk briefly here about some research that I did in the lead up to the NDIS review, which Helen referred to, in partnership with the Brotherhood of St. Lawrence. We started by mapping what was promoted as being available to people with disability outside the NDIS. And then we compared it to what people with disability and their families told us about their experiences of trying to find services and support. And then secondly, what advocacy organisations and service providers told us that they were seeing and hearing on the ground. And in pulling that evidence together, we could distinguish three key barriers to people with disability finding support outside the NDIS when and where they needed it. And they were essentially the availability of services, the affordability of services, and the accessibility of services. Our research for the academics in the room had really significant limitations. It was intended to be a little bit of a suck it and see pilot study. We didn't have much money. It was conducted during COVID. It only covered 3 states. But what it uncovered was a gap so stark between what was being promoted as being available to people with disability outside the NDIS and what was actually being delivered that we just simply couldn't keep a lid on it. It was clear in that research, and as I said, in thousands of submissions, and I mean literally thousands of submissions to government inquiries, that the paradigm shift that was needed to sustain the NDIS, which is an inclusive and accessible society where all people with disability can fulfil their potential as equal members of the community with specialist or bridging support when it was needed, wasn't happening. So simply directing people with disability to mainstream or community services didn't address the kind of issues that came up in our research: entrenched socioeconomic disadvantage, entrenched discrimination, and particularly the impact of the NDIS market model on community supports and on the cost and availability of disability-specific supports for people who didn't have NDIS funding. This approach also leads people with disability and their families into an overwhelming labyrinth of information as they seek the right fit for their needs and financial circumstances. And our research said that was, in many cases, unsuccessful. So both markets and core government services to date have shown that in some circumstances they're either unwilling or unable to bear the costs of providing services to people with disability or adapting to meet their needs. But it's a double driver of future government costs. So when people with disability and their families are unable to find or access the support that they need, that could delay or prevent their entry to the NDIS or prevent their disability from exacerbating. And in the process of that, exhausting their personal resources and their network of informal supports, they reach the point of crisis where it becomes much more expensive for government to intervene. So we've moved on now to the next slide, which is what are foundational supports? What's the proposal at the moment to look at foundational supports? And this came from the NDIS review, again, calling for a connected system of support. Now, general supports in this picture look very much like the old information linkages and capacity building component of the NDIS, and targeted foundational supports are new. It's important when we look at this to note that investment in ILC, information linkages and capacity building to date, has been less than 1% of the overall investment in the NDIS. And not only that, research into ILC suggests it's had little impact on outcomes for people with disability and their families, or on curbing demand for NDIS funding. So we're really missing some critical information when we're looking at the new foundational supports at this stage. And that includes, what is the budget? Are we looking at the old ILC budget, or is there new money? How will the funding be distributed and who will decide that? Critically, what data and evidence is underpinning this work? And finally, through what portals or mechanisms these supports might be offered or available. And I think critical challenges for targeted supports will be reconciling the social model of disability with our firmly entrenched medical model for rationing access to public resources. And the second is, how do we reconcile commitment to inclusion of people with disability in mainstream life with maintaining segregated services for them? So I'll hop on to the next slide, Helen, if you don't mind. And this is hard to read, but I just want to touch quickly on the government's roadmap for disability reform before moving on to just quickly touching on some challenges ahead. So you'll see in this roadmap key phrases like working together, engagement, consultation, co-design. But of course, anyone who studies this kind of policy work knows that the devil lies in the detail. So this policy and practice landscape on this one page has all the hallmarks of issues that persist in the study of complex system design and network governance. And those are issues like asymmetrical access to resources and information, red tape, inconsistent framing of problems, cost shifting, which is a big one here, fragmented evidence, blurred accountability, competing priorities, and of course tensions between market forces, which is what drives the NDIS, and calls for collaboration and co-production of public policy outcomes. So let's unpack some of those in the case of foundational supports on the next slide. Thanks, Helen. One of the things that Helen touched on was, the challenge with the the introduction and rollout of the NDIS was this idea that it was a plane built in flight. And I have to say that the reforms suggest that not much has been learnt from that. I think we're in stage 2 of the plane continuing to be built in flight. So key challenges, and again, I could talk about this for days, and I'm just going to whip through it and we can unpack it in questions. The order in which the changes are happening are problematic. The government hasn't formally responded to the recommendations of the NDIS review, but it's actually addressing them as this unfolds. New NDIS legislation has passed that is restricting access to and the use of individual NDIS funding before alternative supports are in place. General supports are being designed before targeted supports, and frankly, they're of limited use if the required mainstream and foundational supports are unavailable to people with disability. The second key challenge is the process by which these changes are happening. So we've got federal, state and territory governments in the mix of this, a lot of cross-jurisdictional work even within levels of government. And they're considering the design and implementation and risks and costs and benefits of foundational supports in an absolute maze of competing reforms, evidence, priorities, interests, and a particular bugbear of mine, ministerial accountability. They've also committed to co-designing the supports with people with disability, as we saw in the roadmap. But the activity in this space is overlapping. The disability community is completely overwhelmed by the amount of information that it has to provide to government. The timelines are tight, and I think critically, in the case of this reform, trust in government is at an all-time low. And the third thing I want to talk about is accountability, because it does factor into this very critically in terms of who's paying for what, who's responsible for the mechanisms by which these supports will be provided. And also we know that there are real challenges in recruiting and retaining a workforce to do this kind of work. So I'll leave it at that on that note to pass over to Sophie, and we can go into more detail in the discussion.
Thanks so much, Sue. That's one of the kind of clearest and thoughtful kind of articulations of foundational supports, in a very woolly kind of context. Final speaker on the panel is Sophie, who's based at Crawford School, and she's done a lot of work around marginalised groups and their access to the NDIS. So she led work around gender and formerly incarcerated people accessing the NDIS. And she's going to talk about something that's really hot off the press, given that the support lists, so what will be funded and not funded in the NDIS, were only launched just 2 weeks or slightly less than 2 weeks ago. Is that right, Sophie?
Yeah, about 2 weeks, the 3rd of October.
So this is some kind of some quick analysis around that. So thanks, and over to you, Sophie.
Thanks, Helen. And I know that POLIS colleagues might have to go soon because you have your town hall. So I'll try and finish main parts of what I'm going to say before then. But can I just say, if your town hall is anything like the CAP town hall, the start of it will be very generic and you won't miss much. So you could be a few minutes late, is what I'm saying. So it was hard for me to decide what to talk about today because there's so much going on with the NDIS, and everything changes so fast that a lot of the research that I've done already feels out of date. But as Helen was saying, this reform has been so controversial, this detailed list of what supports are allowed, which are in the form of transitional rules made under the new NDIS Act. So this is one of the things that is supposed to help reduce the projected growth of the NDIS by 14 billion over 4 years. And I know that there are a lot of people here with deep knowledge of the NDIS reforms and reviews, and possibly some people who've been involved in them. So if I mangle anything in my attempt to get my head around this, please pipe up after I'm done and correct me. But it is true that there has always been a bit of confusion about what you're allowed to buy with your NDIS plan. And the NDIS review did say that there should be more clarity around that. So before a couple of weeks ago, this on the screen is roughly the kind of things that were allowed and not allowed. There was no detailed list in the legislation or rules, but NDIS staff and planners used operational guidelines to figure out what kinds of things were approved supports. And for figuring out what was NDIS and what was the responsibility of another service, there were the APTOS, the Applied Principles and Tables of Support, and that was a policy document agreed with all the states and territories. So those were the kind of things that people used to decide. But because plans were negotiated line by line, a lot of the items were approved beforehand. So if you wanted to do something outrageous, it was unlikely to happen because the planner would just say no and it wouldn't end up in your plan. Helen, next slide. Thanks. So now the NDIS is moving away from bottom-up planning away from the line-by-line approach toward a more flexible model where your overall budget is set at a certain point, and there will be some stated or fixed supports and some portion of your plan that can be used more flexibly. Plus, what is and is not an NDIS plan in inverted commas, NDIS support, what is and is not that, is quite important in the new legislation. So they rushed to bring out this list to coincide with the Act coming into force on the 3rd of October. It's a transitional set of rules, meaning this will do for now, but after about 12 months, they'll be looking to replace it with a more permanent set of rules as the rest of the new legislation is sorted out. And what I've got on the slide, I know you can't see it and you're not supposed to see it in detail. It's a very high level look at the new transitional list. It's basically the contents page for the 17 pages of list. So quite detailed. The framing from the government and the media has been that the list is the result of the NDIS review, but an extensive list of what can and can't be funded was not recommended by the review. What it actually recommended was introducing a support needs assessment for a reasonable and necessary budget set at a whole of person level that could be spent flexibly with minimal exceptions. And I use the word minimal. So on the one hand, the review is saying, let's reform the scheme to make it more flexible. And on the other hand, the government is saying, here's an itemized list of everything you can and can't buy. So what a list like this tends to do, a lot of people think, is stifle innovation and push people towards specialized disability products and services, which some people call shopping at the disability shop, which is an expensive shop, as we know from talking to people with disability who tell us about their tricks for saving money by buying mainstream products and services instead. Or people talk about how there's a disability tax, like a wedding tax on specialist items. And in this list, there's a heavy use of words like adaptive or assistive, which is kind of code for it's okay to buy things specifically designed for disability, whereas a lot of things called standard or day-to-day are out. But people with disability can be really creative about things that will improve their lives and prevent current and future cost, which is actually the point of individualized funding, to allow people who know the most about their own needs to figure out what will best support them in the context of their personal life goals. And mainstream supports can also help people stay connected to the community, rather than hiving them off over there with the disability stuff, which feels like going back towards segregation people have been talking about. This is, what we've been trying to move away from for decades is this segregation. And so examples are key. So examples that people have been using to talk about this list are things like robotic vacuum cleaners, which are cheaper over time than getting someone in, a support worker or cleaner, to vacuum, or air conditioners, which are designated mainstream, but they're useful for regulating temperature for people who have MS, or thermomixers, which are cheaper than getting support workers in to cook for you, and they can promote independence and self-efficacy because people can do things for themselves, which many people prefer. Or frozen meals keeps coming up again and again as pre-prepared meals that are cheaper than support workers quite often. Smartwatches, they aren't allowed, but they can allow people to monitor the health of a family member who might have communication difficulties, and potentially alert the family members to all sorts of issues in a way that prevents health crises. So it's preventing expenses in another service system. Generators and batteries are out, but people might need them to keep their assistive devices operational. And holiday packages can be cheaper than respite care and achieve the same purposes. So obviously, like everyone said, we could go on forever about this, but the last example I want to use is that the new rules specifically disallow rent. But one of the innovative living options that people have been trying, especially in Western Australia, is an arrangement where an able-bodied person gets their rent subsidized, and in return, they provide semi-formal support to a disabled housemate. And this can be a lot cheaper than having a support worker shift for overnight, especially if someone doesn't need intensive support. And it can be a better arrangement socially. But if rent can't be paid through the NDIS, this option is off the table. So all of these things involve products which are deemed mainstream or everyday, so they aren't covered by the NDIS, but some people need them specifically because of their disability. And the key is it depends in each case. So trying to nail down everything in advance just doesn't make sense. And next slide, please, Helen. There are some categories of things where people will apparently be able to request a replacement or substitution. But that's only 2 categories of supports. And it's not clear yet how this will happen because the process hasn't been designed yet, or at least hasn't been released. And just from what we know about how NDIS processes tend to go, it's going to be a burdensome thing to manage, putting the onus on people to explain why they need something and navigate that process of substitution. And apparently, if the NDIS says no, that decision is not going to be reviewable. The other thing the list does is clarify what is out of the NDIS because it should be provided by a mainstream system like education or justice. But the problem with clearly ruling things out with regard to those systems is that if the support isn't actually provided by mainstream, you get nothing, like Helen was saying earlier. You have 3 minutes till we lose the ANU people, so moving ahead. This is the way the list was covered by the media. I had to bring this up because yikes. If you wanted to paint people with disability as irresponsible sponges of government largesse, this is one way you might want to do it. Of course, commentators were going to jump all over items like Reiki and crystals and sex therapy and cuddle therapy because they sound bizarre. But this is not what NDIS funds were being spent on anyway. I mean, it might have happened here and there, but as I said, these are not things that NDIS planners would have approved in this line-by-line bottom-up approach. Hardly anybody has actually been approved for sex services. The bulk of overspending is not about individual misconduct. It's about large-scale fraud being perpetrated by big service organizations, overcharging, client capture, dodgy practices. But this kind of thing, this coverage, works to damage public opinion of people with disability so that when you cut their programs, there's less of a public outcry, I might say, if I were being cynical. So to summarize, it seems to me and lots of other people that having a detailed list like this goes against the spirit of the NDIS. Nobody really seems to want it, and the NDIS review didn't recommend it. Last slide, Helen. The other thing that's been really controversial about this is the process aspect. The NDIS review was really clear that all major changes need to be co-designed, but this barely even had consultation. The draft list was released in August. The DSS opened a brief consultation of about 2 weeks, but it was extended to 3 weeks after people made a fuss about it. But this is just not long enough for any community consultation, let alone disability policy. And this was not co-designed. And we lose ANU in 1 minute. So I will say that a lot of us at ANU have recently been given a worked example of what happens when large changes are planned for a really important institution and you're given a 2-week consultation period. It doesn't feel that real. It doesn't feel like the consultation is real. But that said, there were thousands of submissions in that brief period on the rules, which shows you how much people care about this topic because the NDIS is so important to so many people and this is such a big change. But then the final list was released. It was not released actually until 2 days before the rules were going to come into effect on the 3rd of October. So that created so much fear and uncertainty about what was going to happen. With people thinking that they might buy the wrong thing and then have debts raised against them to pay it back, which is something that the new legislation enables. I could have put any one of 1,000 community comments up on that slide, but I picked this one from a public place because it seems like a pretty good encapsulation of how a lot of people are feeling about all these reforms. At a certain point, people feel so badly treated and so let down by how things have gone in the past that it doesn't really matter whether some of the proposed reforms might be good or might be what's needed to control costs and improve sustainability, because the trust isn't there that government will do anything in anyone's best interests. And everything kind of feels poisoned, and that affects implementation and it affects co-design going forward. So my last thing I'll say is just looking to the future when the more long-term rules are designed, people are really hoping that there is more of a co-design approach and that policymakers really take account of all the feedback that is out there about segregation and flexibility and creativity and the freedom to choose the supports that work for them. So this list has been rushed, but in 12 plus months, in consultation with community and with all the states and territories, there is hopefully time to do it better and really embrace the co-design that the NDIS review recommended. I will leave it there. Well, 1 minute late.
Thanks so much, Sophie, and really great kind of nuanced analysis of something that's happening kind of right at the moment. And thank you to all the panel members for absolutely fantastic presentations. There was a comment in the chat, and I know it was slightly tongue-in-cheek, kind of about, well, should the plane have ever kind of left the ground if it wasn't built yet? And I guess one of the issues was, I think there was some concern that some of the support for the scheme might be lost if it didn't move, if it didn't go as quickly as it might have done. It was a rare kind of time of kind of agreement around that. I don't know that you'd ever be able to design all of it in real detail before you do that. Although I have to say there was Simon Duffy, who's worked in the disability sector in England for many years and pioneered kind of personal budgets in that scheme, did write a kind of report for the NDIS as it was being established that said, look, we've got some experience of this. Here's some stuff to learn from us. Don't do this, this, and this. And of course, they got designed into the into the scheme. But one of the things I often say when I talk about the NDIS, I mean, our jobs as academics is often to find the things that are wrong with things, and so that's a bit of a reflection here. I think for me, when I talk to people on the NDIS, there are a bunch of people for whom the NDIS has been absolutely transformative. It has really changed their lives and how they're able to live and be included in society. There's some people who have not noticed a massive amount of difference. Okay, so they would often be kind of people with intellectual cognitive disabilities who live in congregate care settings and maybe work in ADEs or something like that. And then there's a bunch of people for whom the NDIS has been incredibly frustrating and difficult to navigate. And, you know, there's more than 660,000 people in the scheme, so there's never going to be one story about success. But internationally, it's a real beacon, right? It's the only kind of universal, non-means tested, uncapped budget that we see that's national, that we see in disability around the world. Nobody else has invested in disability in the way that Australia has, and that's something we should be really, really proud of. But there is still some stuff that could be done better, and that comes particularly from the disability community pointing out some of the things that could really happen. And I guess one of my concerns is, I think a lot of, or a large amount of the reforms that we're seeing at the moment are going to take the scheme backwards and limit, as Sophie said, kind of independence and choice rather than necessarily make that better. Got some time now for questions if anybody has them. So we've got one in the chat there. Do we know the population who miss out completely on the NDIS services due to the conditions around inclusion? Stu, do you want to, any thoughts on that?
Well, just that in the under 65 age group, there's 2.5 million people who aren't NDIS participants. And it's important to note that that's not always because they're not eligible to be in the NDIS. For some people, just trying to get in is a hurdle that they cannot get over. And we know that there are particular issues around gender, around culturally and linguistically diverse communities, remote communities. And so just thinking about that group of 2.5 million people who aren't NDIS participants, it's a group that we really need to know a lot more about. And as I said, statistics indicate that that group is growing.
First Nations populations, and I think all the evidence kind of shows that the more challenges you have with communication, the more complex some of your impairments are, and the more kind of complex that lives become, the more difficult it is to secure services that you want. And I think even though there's a number of people with intellectual disability who have NDIS plans, often their outcomes are worse because people find it difficult to be able to advocate for the sorts of things that they want and need. So, you know, the complexity of schemes like this, I always think, and this is probably unfair, but you know, they're middle class schemes designed for middle class people. And if you fall outside of that, it becomes more and more difficult to be able to navigate some of that. Any other questions? Anybody pop your hand up and come and ask a question if you like.
Yes, so if you're online, you can pop your hand up if you would like to ask a question over microphone, otherwise put it in the chat. In the meantime, I had a question for Lana about your segment of the study. You mentioned briefly, the design of the study, you were sort of focused also on making sure that you were including regional and remote communities within the cohort you were looking at. I think you sort of prefaced saying that you didn't want to presume the circumstance was the same for every single remote and regional community. But I wondered if you did have any sort of findings that were teased out in relation specifically to regional and remote communities in that study?
Absolutely. Thank you, Christian. So one of the things that we heard really strongly as part of this work was actually around presuming a level of infrastructure or community availability for reform. So, for example, one of the ideas in the Priorities Project final report is re-establishing community transport as a service. So this was reasonably common, delivered usually at a local government level prior to the NDIS rollout, when much of that support rolled into individualized funding. So we actually had the joy of testing out that idea in our reform session. And thankfully, we had some brilliant people who were working in regional, rural, and remote areas who were able to talk about, okay, how would that be funded if that existed? LGAs might not have the resourcing. State government investment differs across states and territories. So is the LGA always the best partner for that work? So you really have to look at things from that hyper-local level to understand exactly where the barriers are. So even if you have a need that is broadly possible to meet across the country, you really need to look at what you have available to deliver that need as well. So that's a bit of the kind of really deep conversations that we needed to have in order to really understand what we needed to ask for. So there's a bit of flexibility in that ask as a result to make sure that we don't say that it needs to be LGAs, because that isn't always going to be appropriate.
Thanks, Alana. Now, there's a question from James, thank you, about registration of providers. And I'm going to throw this to Sophie, because this is one of the things she was going to mention today. So James asks, while registering providers and support workers is recommended according to the NDIS review and the new task force, do you think it will be beneficial in improving outcomes?
Well, yeah, thanks, Helen. I thought you would throw that to me, and it's a hugely complicated. I could have talked for 10 minutes about just registration, and Helen has done a lot of work on this too. So perhaps you can jump in after me. There is no short answer to that question. Registration is important and it's complex, and I think perhaps Helen and I didn't quite agree with the way that it was approached in the original NDIS review, which was mandatory registration, because we did some research with people about why they use unregistered providers. Because, well, Helen knew that this would be an important topic coming up with all the reforms. So we got in there and we did this research because we knew that people like to use unregistered providers, but we didn't quite know why. So we went and talked to them, and there were lots of reasons that people like to use unregistered providers, bound up with choice and control on the one hand and lack of trust in the regulator on the other hand. So there are more providers who are unregistered, which increases the pool of providers, which makes people feel safe often that they can choose the right provider for them. Lots of reasons, but also just there was very little trust out there that registration actually did anything. Not for everyone, but for some people, they were observing all of these high-profile abuse and neglect cases that were going on and noticing that most of these cases involved registered providers. So they're like, why would I bother to use a registered provider? But registration is important, certainly for some things, for things like behavioral support, restrictive practices, for high intensity housing support, that kind of thing. I think it can play a role there, certainly, but we didn't agree with the mandatory registration recommendation in the NDIS review, but then there was a task force implemented to look at that question again, because there was, after the NDIS review, there was a bit of an uproar about mandatory registration. And so the government then instituted a task force to look at this issue in more detail. The task force recommended some modifications to what the NDIS review had recommended, which was that not all providers should be registered, that there should be some exceptions, and that people who self-direct their supports shouldn't need to use registered providers, that they should register themselves effectively in a co-designed process. And so they wouldn't then have to register all of their independent support workers that they were using. So that's a complicated answer to the question. I think through this task force, we've sort of refined the ideas and come a bit closer to something that might be useful and acceptable. But overall mandatory registration for everybody, no, probably not a good idea. Helen, anything you want to add?
That was a great answer to that question. And I think, as you say, registration is only one part of the picture. We know that there are issues in terms of the Quality and Safeguards Commission making kind of complaints around things, and they're not being actioned, they're not being picked up. So you're going to need to see some significant reform to that regulatory organisation if kind of registration is going to be able to have teeth. So yeah, that was a great answer, Sophie. Thank you. No more questions. So I'm going to give. Oh, sorry, Christian.
No. I just thought if there aren't any more questions, I might leave us with one final one that's potentially a little bit unfair and unanswerable, but I'll see how I go. I'm not too sure exactly who to direct this to, but evidently, Helen and Sophie, you had written that paper about the post the decade of reform of the NDIS, and that's sort of the focus of this seminar. So I wondered, going forward another decade, where might we be with the NDIS, or where should we be with the NDIS?
Do we want to go around the panel? Lana, do you want to start, or is that unfair? Where would you like to see the NDIS go?
Yeah, more than happy to start us off. I will be coming in quite positively, so please be warned. In short, I think the sheer scope of reform that we've currently experienced is massive for one particular area of government, for lack of a better description. We have the biggest body of knowledge on the lived experience of people with disability that we have ever had right now. And I really want to see that used. I also think the conversations around P2, particularly your work, Sue, are so important, because one of the conversations that came out of the NDIS review was the only lifeboat in the ocean concept. And what that means is that a lot of support now is defined by the NDIS, when there is a real need to return to meeting the people with disability, meeting the needs of people with disability in the community, as well as with targeted supports. So my real hope is that we start sparking some conversations about what proper inclusion looks like, and we start having those conversations from a very foundational level in terms of what's working for you. Can you get ID? Can you go to the doctors? Can you do fun things? What was it like if you went to the football? All those kinds of things. So I think we have so much information, and I'd really, really like to see a return to asking the real questions that everyone gets asked. How are you going? What's working? What's not? And rebuilding our Tier 2 foundational supports environment based on that, rather than based on what is not the NDIS. So over to you, Helen.
Oh, thanks, Lana, and thank you for always being positive in the room around that. Sue, how about you?
Can't really top what Lana said, other than to say what I would like to see is a really inclusive and accessible society where people with disability are equal citizens and have access to bridging or specialist support when they need it. That's what I want the future to look like. And I think just to note a particular thing for me is that 15% of our working age population now are people with disability, and they are very marginalised in terms of both participating in the labour force and finding work that suits their needs and circumstances. It would be good for everyone if we can just improve outcomes on that front as well.
So anything to add, Sophie?
Yes, I sign on to what my learned colleagues have said. I do think the NDIS will still be around in 10 years because people fought so hard for it, and because they will continue to fight for it, and because it's not perfect, but it has changed so many lives. So I don't think we will let it go, at least not in that time frame. But what my hope is that we get much better at understanding and recognizing the whole economic picture of what the NDIS contributes, the jobs that it creates, how it allows people with disability and their families to be able to work and study and participate in life, and the costs that it avoids in other service systems like health and like the justice system. So I think we need to get much better at accurately valuing the NDIS, and perhaps using that sort of method, we can change some of the conversation around overspending and ballooning costs, which is so negative.
Absolutely agree, Sophie, and I think that's so important because we often talk about the NDIS as being an uncapped budget, but it's not really, in the sense that it's capped by what the population is willing to pay for that. And I think at the moment, all of the discussions is on costs. We don't have good evidence around benefits, so really doing some whole of government modelling and really thinking about those benefits, I think, is really crucial, because if we continue to see the sorts of headlines that you were showing as there, Sophie, and this is what happened in England, kind of, if you go back like 13 years now, there was an austerity crisis similar to our kind of cost of living crisis at the moment, and people with disability were painted in the media and in discussions as being responsible in some way for some of that, and it became easy to demonize people and to pull spending out of those services. And so got to be really careful to make sure that there's still community support for the scheme. Otherwise it makes it too easy to be able to dismantle. Thanks everyone for coming along, and thank you so much to our panelists for speaking today, and Christian for organising. So back to you, Christian.
Yes, yeah, I'll just wrap up briefly. Thank you so much to all of our panelists that presented today. Thanks for all of those that came along. I think you'll agree with me, it was a very extremely rich and generous presentation, and we really appreciate you taking the time to come and present to us here. So thank you so much. We really do appreciate it, and we'll leave it there. And thank you all for coming, and we'll see you in another 2 weeks for our next seminar.